All right, good morning, everybody. Thank you guys so much for being with us this morning. We still have some people coming into the class, but we are going to go ahead and get started. It is 9 o'clock, October 26, 2023, and today we have the honor of having Dr. Mudagadra with us to speak on the very important topic of breast cancer. My name is Tina Wahardo, dietitian and health educator with Bronson Community Health, and we are so appreciative of Dr. Mudagadra for presenting with us on breast cancer. We are going to go ahead and get started. So as we start all of our classes, we want you to be aware that closed captioning is available in today's Zoom presentation. So if you need text, you can go ahead and just click on your little CC button at the very bottom of your screen and have that text displayed to you. All of your controls will be at the bottom of your screen. Again, that is where you can mute yourself, unmute yourself. We will have the option of unmuting at the very end of the presentation. So if you have any questions, then that is where you're going to find that feature. Today's class is being recorded, so we understand if you would like to have your video off, but we also like to see smiling faces as well. So feel free to keep your video on as well if you would feel comfortable with that. When we start our virtual healthy living classes, we always want to provide you with information on where to get access within Bronson. We're going to talk a little specifically about how to find providers in the area of breast cancer, but generally, bronsonhealth.com in the Find a Doctor feature, you can find a primary care provider or a specialist, or you can also call our care advisors at the phone number listed on the screen, and they can help you find a doctor as well. Bronson Health Answers is always available if you're ever having any needs in regards to your MyChart, whether that's where to find items within MyChart or how to use MyChart. Bronson Health Answers is available. If you ever need any billing questions answered or a payment plan set up, then Bronson's patient accounting is available. And lastly, we have our estimator tool within the Bronson MyChart. So if you're referred for a service, let's say maybe a mammogram, and you want to know how much that's going to cost you out of pocket, that price estimator team and tool within MyChart can be of assistance there. All right, so again, thank you so much for being here today. We've had a few extra people join in since we introduced Dr. Mudagadra presenting on breast cancer today. Today's presentation, Dr. Mudagadra is going to go over what breast cancer is and the common signs and symptoms to be on the lookout for, factors that can increase or decrease your risk of developing breast cancer, how to complete a self-breast examination, how often, when, and how to get a mammogram, how breast cancer is treated, and then how to find a provider working within the area of breast cancer and other resources available to continue learning about breast cancer. Those are our goals today. So before we get started, we want to hear from you, whether it be on a scrap piece of paper that you might have to the side of you, or you can answer in the chat. We want to hear you answer some of our true and false questions to get us started. So question number 1, true or false? You can get breast cancer even if it doesn't run in your family. What do you guys think? Answer in the chat if you feel comfortable. Is that true or is that false? All right, Dr. Mudagadra, I'm not sure if you're looking at the chat, but I'm seeing a lot of true answers there. Very good. Number 2, if breast cancer runs in your family, you're sure to get it. What do you guys think? Is that one true or is that one false? All right, seeing lots of false answers. Not sure, but it does increase the risk, someone is saying. And then number 3, you still need a mammogram even after menopause. What do you think about that? Is that true or is that false? Some people are saying yes, true, true. Very good. All right, and number 4, men can get breast cancer. Is that true or false? All right, lots of trues there as well. I don't see any falses there. Number 5, surgery and needle biopsies can cause breast cancer to spread. True or false? All right, I think the majority is saying false on number 5 as well. And then lastly, somebody says, I've always wondered about this one. So maybe that's number 5. Number 6, there's nothing you can do to lower your breast cancer risk. What do you think about that? True or false? There's nothing you can do to lower your breast cancer risk. All right, overwhelming majority is saying false on that one. Very good. And we're going to go over the correct answers at the very end of the presentation. So again, we have the distinct pleasure of having Dr. Muda Gaudra with us. Thank you so much. She is going to go through her presentation, and then at the end, we're going to open it up to questions. Take it away. Thank you.
Thank you, Tina, for the introduction. Good morning, everyone. Is everyone able to hear me, Tina?
Yes.
Okay. My name is Dr. Muda Gaudra. I go by Dr. Nev. I see some familiar faces there. Thank you for joining the presentation today. So let's start with the slides. What is breast cancer? It is a type of a cancer that starts in the breast. It can be either in one or the other breast. What is exactly cancer? Cancer is when the cells kind of lose the signal where you're supposed to be replicated at a certain rate, right? So cancer cells happen because they lose that signal and they start reproducing at a much faster rate, and that's when the cancer happens. And breast cancer can happen in any areas of the breast. It can include, the outer portion. It can happen in the nipple. It can happen in the areola. So it can be any areas of the breast. Next slide. So what are some of the risk factors, right? So first one is the family history. If somebody has history of breast cancer or ovarian cancers in the family, then yes, there's a high risk of you getting breast cancer. Increasing age, again, as I mentioned, the whole reason why cancer cells happen is because they lose the signal about how they should be reproducing. So as we age, our skin wrinkles, we get gray hair. Similarly, the cells, the breast cells as well, they kind of start aging and end up getting cancers. So in fact, all of us born as women have a 12 to 12.8% risk of getting breast cancer in our lifetime. So between 50s to 70s, that risk is around 2 to 5%. But as you get over 70, the risk actually increases by about 7%. So 1 in 14 women will be getting breast cancer after the age of 70. So increasing age is a risk factor for getting breast cancer. Dense breast tissue. How do we know if you have dense breast tissue? It's by mammogram. So if you have had a mammogram and it does say you have a dense breast tissue, yes, that does put you at a higher risk of having breast cancer. Previous breast issues. So if you have had issues where you've had a biopsy done, it's not cancerous, but they may say, hey, it's atypical hyperplasia. That basically means there are some changes in the way it's reproducing. That would put you at a high risk for getting breast cancer. A benign breast biopsy does not put you at a risk of breast cancer otherwise. Genetic mutations, that is basically where you have a mutations running through your family. Say you have multiple members in your family having breast cancer. You do genetic testing. And if you do have a mutation, yes, that does put you at a higher risk for having breast cancer. The most common mutation that we come across, or something that you might have heard of, is BRCA or BRCA. But there are many other mutations. We test up to 36 mutations sometimes to see if you might be at high risk for breast cancer. Lastly, lifestyle risk factors. What are the risk factors? I think it's in the next slide, Tina. We can go over those. I think we'll eventually talk about that. So signs of breast cancer, the most common one would be you feeling a lump, right? But other than that, any abnormal swelling in the breast, skin looking like an orange peel, like dimpling of your skin, is a sign of breast cancer. If you do notice any pain in your breast or nipple, yes, that should be something you want to talk to your PCP about. Nipple retraction, either nipple getting flat or turning inward, is an early sign of getting a breast cancer. If you do see that the nipple or the breast skin is red, dry, flaky, or thickened, nipple discharge could be bloody, could be just watery, but something that's not breast milk, yes, that's something you want to bring notice to your PCP. Lastly, swollen lymph nodes could be under the arm or near the collarbone. Okay, these are all the signs of early breast cancer. Rarely, I do want you to know about certain symptoms that indicate an advanced breast cancer. If you notice that you're losing weight without wanting to, right? Unintentional weight loss, losing appetite for no known reason. And lastly, waking up drenched in sweats, unexplained fevers, or having pain in a part of your body which is not explained by common illnesses and something that does not go away, you definitely do not want to ignore those. So unexplained weight loss, appetite loss, any pain, could be headache, could be abdominal pain, something that kind of persists, do not ignore those. Next slide. So how do we find the breast cancers? Mammograms, 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 right? So obviously self-exam, you should know what your breast looks like for you to figure out if something looks abnormal, one. And as the slide mentions, you usually find it when you're showering, dressing, or doing some kind of household chores. You have a pain somewhere and then you feel it. That's how you usually feel it. And know your breast. I do recommend self-breast exams once a month. And the next slide talks about how to do self-breast exam. We'll talk about that. I'm sorry, I apologize. I'm not familiar with the sequence of the slides, but I'm sure it's coming up. So talking about mammograms, we have different cancer screenings that are recommended in this slide here. The one on the left side talks about cervical cancer screening. Starting age 25 is when you want to start getting your pap smears done. Ideally, pap smears are recommended every 3 years if you have normal pap smears. If you do have something abnormal, then your primary care or your gynecologist will recommend getting it done sooner. But at this time, the recommendation is to do it every 3 years. Starting age 40 is when you should ideally be starting your screening mammograms. Okay. You continue with your cervical cancer screening up to the age of 65. 45 is around the age when you start getting screening for colorectal cancer, which is again by means of a colonoscopy. And more so for African American males at the age of 45, we should start discussing prostate cancer screening. And how often do we do the mammograms? The recommendation is to do it every 1 to 2 years. Next slide, please. All right. So checking your breast is as easy as TLC. T, touch both breasts. L, look in a mirror. C, check with your daughter. So how do you examine your breast? Don't try to hold on to the breast tissue. You do it along the flat of your palm rather. You go from top of your breast all the way to your nipple and go in a circular motion all around your breast. That's the best way to examine your breast and to feel for any lumps or masses. Other than feeling for the breast, I also recommend feeling for your armpit. And when you're examining your armpit, do not raise your arm up because that extends the muscles and the tendons in your axilla and it's hard to feel anything. So always keep it a little flex and go deep in and feel for any abnormal lumps or bumps. Next slide, please. So how do we reduce the risk of breast cancer? So this was the slide that we didn't talk about, right? What are the risk factors that are modifiable? One, maintaining a healthy weight. So if somebody is overweight or obese, they do have a high risk of getting breast cancer. So we should, in general, try to be more active physically. So when we say stay active, that is 30 minutes of exercise at least 5 days a week. That comes down to 150 minutes of exercise each week. It could be divided into 30 minutes over 5 days, or you could do it all in 3 days, whatever works, but try to do a minimum of 150 minutes. For somebody who has not worked out for a long time, I recommend starting, hey, start with 15 minutes a day. and gradually go up to 20 and 30, because sometimes it's hard to just jump into the 30-minute, and that's an easy way for us to not continue doing that. So start low and then eventually bump up to that 30-minute recommendation. So smoking does increase risk of breast cancer among many other cancers. So definitely avoid smoking. If you are smoking, get help. There's a lot of ways to bring about smoking cessation. There are pills, there are patches. So, and there's therapy sessions. So definitely try your best to avoid smoking. Alcohol also does increase the risk of breast cancer. And these are all actually based on data. There's actually been studies done that say, hey, smoking, drinking alcohol, being overweight does put you at high risk for breast cancer. Managing stress to the best we can. Again, exercise helps manage the stress. So exercise is recommended. Eating healthy diet. What do you mean by healthy diet? Less of processed food, right? Less sugars, more of fruits and vegetables, because they do have antioxidants. The more the color of the fruit or the vegetable, the more antioxidants they have. So definitely highly recommend more fruits, vegetables, lean meats over red meats. And lastly, for new mothers, consider breastfeeding, because breastfeeding does confer a protective, some kind of protection against breast cancer. Again, the studies that have been done shows duration matters. For every 1 year of breastfeeding that one does in a lifetime, the risk reduces by up to 4 to 5%. Next slide, please. Okay. So how is breast cancer treated? It depends on the stage of the breast cancers. There are basically 4 stages. Stage 1, 2, and 3 are something that surgery will always be offered, unless some rare cases, for whatever reason, we may not offer, and that's case by case. But most often, stages 1 to 3, we do recommend surgery. Stage 4 is unfortunately something that has spread beyond the breast or the lymph node, and that's something most often surgery is not offered for. Okay, so 1 is surgery. Next slide. Next slide, please.
Thank you. Sorry, I have got a feature going on right now and it's not advancing slides, so give me a second. There we go.
Sure. So again, menopausal status matters. Irrespective of the menopausal status, if you're stage 1 to 3, surgery is always an option, almost always an option. Depending on the kind of surgery, right? Depending on the size of the tumor, there are 2 surgeries that may be offered. One is a lumpectomy, where they just take the cancer away with a little bit of the surrounding tissue, leaving the breast intact. The other one is a mastectomy, where the entire breast tissue is removed. Again, if and when you come across this unfortunate incident, you will meet with the breast surgeon who will talk to you about different options of surgeries. Radiation is basically nothing but high dose x-rays that are given to your breast and your lymph node area if indicated. And not everybody with breast cancer ends up getting radiation. Again, it's case by case, but that's something that may be offered to you based on the kind of cancer we have. Next slide. So systemic treatments are basically either chemotherapy, immunotherapy, or some kind of an hormone blocking medications that are given in the form of pills. Okay, not all cancers end up being offered chemotherapy. One, the chemotherapy is offered based on how aggressive a cancer is. I don't want to go too much into depth unless somebody wants to know, but just as a baseline, somebody, they have a triple negative breast cancer, or what we call as a HER2 positive breast cancer, more often than not will end up requiring chemotherapy. Hormone therapy, or the hormone blocking therapy, is recommended for somebody who has estrogen receptors in their tumor tissues. And lastly, immunotherapy, again, mostly for triple negative breast cancer. So just because you're diagnosed with a cancer does not mean you end up getting chemotherapy, and breast cancer is one of those cancers. Next slide, please. So how can you schedule a mammogram, right? If you're over the age of 40, you actually don't need an order. If you have been seen by a primary care physician within the last 3 years, you can either self-schedule online at any of the locations in Van Buren, Calhoun, or Kalamazoo counties, or you can call the number that's given here Monday through Friday, 7 a.m. to 5:30 p.m. If you are less than 40, however, you cannot just schedule a mammogram yourself. You do need to be evaluated by a PCP. And obviously, you're probably going because you have felt something abnormal. So even if they say, hey, I don't have an appointment for weeks, I would try to expedite that appointment to the best you can, because earlier the diagnosis, earlier the intervention, earlier the stage. So if you're less than 40, call your PCP, schedule an appointment, and then they will schedule the mammogram for you. And this is basically where you're going to find the provider. So we do have oncologists dealing with breast cancer both in Battle Creek as well as in Kalamazoo, and these are the numbers for the providers. And we do have amazing breast surgeons. We have Dr. Ketto and Dr. Rashki here at Kalamazoo. We have Dr. Murray at Battle Creek. You're always welcome to call the offices, get more information. We do have flyers for all our surgeons and our oncologists, which may provide you with more details about each of our specialists. And before we go on to this quiz, there were two other things I forgot to mention regarding the risk factors. Okay. One is any kind of estrogen stimulus to your body. Getting early menarche, late menopause exposes your body to a long-term estrogen compared to somebody who has a late menarche, early menopause. Some of the tumors, especially the estrogen positive tumors, they grow with estrogen, as the name suggests. So they may put you at high risk of getting breast cancer. Two, taking exogenous estrogen supplements like synthetic, right? One, most menopausal patients end up getting hormonal therapy to help with the menopausal symptoms. There is data suggesting that that does, yes, put you at high risk for getting breast cancer. There is some weak evidence about oral contraceptive pills causing breast cancer, but that is short term. Say somebody takes the pills for a year for whatever reason, right? So somebody has heavy bleeding, abnormal periods. Yes, we cannot avoid taking the pills at that time. And whenever you do stop taking those pills, the risk kind of slowly goes away. The risk remains for up to 5 years at the most when you are on oral contraceptive. But after that 5 years, you have the same risk as the rest of the population. Okay. All right. So now to test your knowledge, I think most of you got the right answers. So let's go over that. First one, you can get breast cancer even if it doesn't run your family. Yes, absolutely. Again, the risk factors as I talked to you about, right? So this is true. Second one, if breast cancer runs in your family, you are sure to get it. And it's false. The reason is breast cancer can happen because of one genetic mutation, right? In which case you are definitely at a higher risk. But if you don't have a mutation and it's running in your family, it's probably because of the lifestyle that we talked about. Maybe everybody is on the, is drinking alcohol or smoking or unhealthy weight, things like that, or being on some kind of a supplements that may put you at high risk. But yes, you will not get breast cancer just because there's cancer running in your family. Third one, you still need mammograms after menopause? Yes, that's true. Men can get breast cancer. That is true. I would say the incidence of men getting breast cancer is probably around 200 to 250 men in a year compared to 250,000 women in a year. But yes, so that is basically to kind of spread awareness that even if you're a male and you find something abnormal in your chest area, that's not something you want to ignore. You still need to bring that to the attention of your primary care. And most male breast cancers are treated pretty much the same way as the female breast cancers. Fifth one, surgery and needle biopsies can cause breast cancer to spread. and that is false. It just doesn't. Lastly, there's nothing you can do to lower your breast cancers. That's false. We talked about many ways that we can lower our breast cancers. And for patients who do have genetic mutation in the family that puts you at high risk for getting a cancer, getting the genetic testing is the first most thing, right? If you do get genetic testing done and it shows that you have a mutation, that mutation can put you at high risk for not just breast cancer, but other cancers as well. So meeting with a genetic counselor who may talk to you about the risks of other cancers associated with that particular mutation, and they will talk to you about prophylactic. How do we reduce the risk of you getting that particular cancer and breast cancer? What are the different ways to kind of keep the cancer at bay? So there's a lot of ways to do that. So if there is somebody here who has a history of genetic mutation in the family, first thing to do is request a genetic counselor appointment. You can always directly call the genetic counselors at the Bronson Cancer Center as well. All right. And these are all the different resources that you can find more information on. And we, as oncologists, are always available for you to answer any questions for you. Okay.
And I'm going to put these resources in the chat as well. So if you guys want to view those immediately after the class, and those will be available. So thank you, Dr. Mudagadran. We just learned a lot and we have ample time for questions. So that is great. We have a lot of them in the chat. So I am going to go ahead and stop the recording now.